Thank you all for coming. I think we're going to go ahead and get started just so that we start on time. On behalf of the Global Initiatives team, I'd like to welcome you all to our brown bag presentation featuring Dr. Sakshi Tickoo and Prutha Satpute. My name is Nikki Bundong, and I am one of the two occupational therapy doctoral students working in the Global Initiatives office. I would like to start off by introducing our two great speakers today. Dr. Sakshi Tickoo is a Mumbai-based occupational therapist who specializes in sexuality, mental wellness, and rehabilitation. She is the founder of Sex, Love, and OT, which is aimed at educating and counseling healthcare students and professionals in the areas of sexuality and intimate occupations. Dr. Sakshi also created the OT Shop, which is India's first occupational therapy merchandise store with the hopes to connect occupational therapists globally. Next, our second speaker, Prutha Satpute, is a doctoral resident and a graduate assistant in the NICU Research Lab at USC Chan. The research focus is the exploration of positive sensory exposures for high-risk infants in the NICU. She is also involved in developing a mobile application that would be used to deliver the sense intervention to NICU infants. Before we start, I'd like to ask all attendees to hold their questions until the end of both presentations. I anticipate that there may be many questions, and I would like to prioritize those that were sent via Google Form first. I will compile a list of the unanswered questions to send to our great speakers post-event to answer. I will then email this list to all the attendees here today once it's completed, and I apologize if we are unable to get to your questions during this event, but I hope to address them through this question list. Lastly, I would like to ask all attendees to mute themselves and to change their view to speaker view, which can be done by going to the top right corner of your Zoom screen and pressing the view button, as Ms. Satpute will be using a Prezi presentation that will show directly on her screen. Thank you all for listening, and I will now pass it to Ms. Satpute.
Thank you, Nikki. A good evening to everyone who is here and a good morning to all my folks back in India. I would like to start off by introducing myself. As Nikki mentioned, I am Prutha, who is a doctoral resident at the NICU lab. It's a fairly new lab, so we get to do a lot of cool things and explore and set our own track. Currently, I'm involved in projects that look at trying to develop an assessments for NICU babies who are now 10 years old. I'm also involved in a project, like Nikki mentioned, a mobile application that would deliver a SENSE program to caregivers and mothers of the NICU babies. But more on that later. Today, I will be talking about how OT in India looks like, our journey, me and Sakshi's journey of OT in India, and the cultural differences between OT in India versus OT in US. And I will be talking about all of these things in these 5 different topics that are there on the screen. Starting off with, like always, we start off with the history of OT. The first OT school in India and in Asia was found at KEM, the King Edward Memorial Hospital. An interesting fact to know about this is that me, Sakshi, and a lot of students who come to USC are from this hospital. So we're very proud of that. In 1967, a 2-year diploma course was first officially started for occupational therapy, and it quickly transitioned to the first master's program in India at Mumbai at our school. As you can see, OT was founded at a very early stage. For an underdog country, OT has had its root in India for a really long time. Anyone who is looking into OT in India, I feel they should look into AIOTA. This is the Indian Occupational Therapist Association. This is an official organization that was founded in 1952, and it was recognized by the World Federation of Occupational Therapy in 1954. Currently, there are 17 branches of AIOTA in different states all over the country. There's a separate cell of AIOTA called the Academic Council of Occupational Therapy, which is recognized by WFOT. This cell is responsible for developing occupational therapy curriculum for Indian students. It is also responsible for giving off registration for OTs who are trying to practice in India. Also, they encourage young students and new researchers to develop more research that is India-based. The total number of colleges that offer bachelor's course are over 20, and there are over 15 colleges that offer master's course for OT in India. Another cool thing I'd like to draw your attention to is the Indian Journal of Occupational Therapy. Now, this is a journal that is the official publication of AIOTA since 1955. This is a quarterly publication, meaning there are 4 versions that come out every single year. And despite having 22 different languages in India, this journal opted English as its official language so that not just students and researchers from India can have access to it, but people all around the world can look into Indian OT research. Over 18 Indian and 10 overseas members of the review board look at research papers, case reports, articles, editorials, not just from Indian sources, but from all over the world. Moving on to the interesting bit of this talk is the life of an OT student. Um, we are going to talk about the life of us. Here you can see the 4 of us. A mini shout out to me and my girl. You can see Dr. Sakshi Tickoo to the far left of this photo, smiling through her pain. I'm just kidding. But it's certainly been a journey with lots of ups and lots of downs as well. But today I will be giving you a censored version of how it looked for the 4 years. We start off with 4 years of theory course. I'm looking at it and it just brings back all the vivid memories. But the courses are divided into what we used to call external courses and internal courses. The external courses focus more on the foundational courses of OT, something that all medical students need to know, like anatomy, physiology, biochemistry, pathology, etc. Now, a crazy fact is that although we were enrolled in an OT program, we were expected to know these courses and study them in as much depth as students who were studying to become doctors, like MD physicians. So as you can imagine, these were high intense programs and it was a lot demanding. So when we would be doing our theory exams, we would all be like Jon Snow here, trying to look at, oh, what drug belongs to what class or what are the branches of brachial plexus. I still struggle with that, to be honest. But it made more sense as we looked into OT-centric courses. These were courses that talked about how OT was or what roles of OT was in pediatrics, neurology, plastic surgery, and different other medical fields. 2 things I want to point out here that were strikingly different between Indian OT and US OT is the options of elective. Given that this was an undergrad course, it is considerate that you're expected to know a lot of things in general, but just having so much pressure of studying all these core subjects to a level of depth that was expected at a doctor's level added a lot of pressure to a student who's just entered OT. So this was a difference I found in India versus US, that the options of elective was quite a bit of interesting thing to have here in the US when I pursued my master's. So I could focus my direction and what I wanted to do as an OT. Second thing, there are no OS courses available in India, unfortunately. So what happens is students, OT students in India are very well versed with the technical side of things. They are very good with the technical aspects of their knowledge, but the rationale and logic often is lacking. So we all struggle to make sense of what we were studying as an OT. But there was a bit of ray of hope with the hands-on experience and the practical experience. Over the course of 4 years, we were immersed into practical experience on different levels. During our first year, we were taught history taking. Now, as you can imagine, someone who would come to OT with a minimal idea of what it meant and trying to define occupation for the rest of the year, going into a hospital ward and talking to a patient was a very daunting experience, to put it into mild words. But I felt like these experiences, these practical experiences, were quite essential and helps to improve communication and just gave us the confidence to talk to our clients and their caregivers. During our second and third year, we would apply rationale from physiology, pathology, and have minimal assistance in rehab. So you got a little bit of taste of what OT did. During our fourth year, it made more sense because we were immersed in devising treatment plan for and OT outcomes for our clients individually. Uh, I want to address something here. During our third year, it's a part of a course curriculum that you are required to observe gynec surgeries or surgeries in NICU or sorry, surgeries in neuro, plastic surgeries, or other medical fields. I was fortunate enough to get exposure and go to the ER and watch a C-section or a FDS reconstruction. So as students of OT, it was very cool to get into an ER and experience that environment. Um, Moving on to a more intense 6-month period, which we call as internship. Uh, you guys often refer to this as fieldwork experience, but in India, we get a 6 months of complete immersion in hospital wards. Now, during each month, you are allotted a particular practice setting, for example, pediatrics, neuro, medicine or surgery, community rehab. These settings are further specified into their specialty. For example, for pediatrics, we were given exposure to school-based OT, OTs in the NICU, OTs for SI. And I say this was an intense experience because you would be responsible to handle a caseload of around 50 to 60 patients sometimes in a day when you would be in a community-based rehab setting. And if all of this was not enough, you were expected to write and publish a thesis on a research topic of your choice. But not everything was so demanding. You always found a wiggle room to show some creativity and adaptive skills. This could be shown during annual student conferences that were organized by AIOTA for students. Uh, these would encourage students to come forward and develop softwares, applications, or devices and serve population who were less privileged. One example of that I would like to give is this photo of mine holding this device here. This was a modified finger CPM machine, which is a continuous passive motion machine. And we got to collaborate with engineering students and develop this CPM model, which was individualized to each digit. So patients who would have injuries to a selective digit or have limited ROM for a particular digit, you could put that on that digit and then modify degrees for each joint. So that was pretty cool. And okay, so now this is a one bit interesting contrast to Indian OT and US OT is adapting these Western ways of studying. I'd like to give you 3 examples of certain incidences that occurred in my life during my internship. The day I learned about doning and doping for stroke patients, I was very happy after reading Pedrity. I was like, this is very cool. And I walked up to my client, and as I walk up to her, she's a 60-year-old lady with a stroke, with a hemiparalysis. I realize all my knowledge and my training of doning and dofing is going to be absolutely useless because this lady has never worn a shirt or a pant in her entire life. She's wearing a sari. So you are in front of a patient who is demanding certain solutions for their ADLs, and you have to come up with practical solutions in that situation. So I have to teach her how to don and doff a sari, which is an Indian attire. Similarly, there was a patient with a FDS reconstruction surgery done. He was 45-year-old male working in a factory, and he had his arms being in a cast. And I had learned about using a universal cuff to help him with his eating. Using that cuff, we were going to put spoons and fork. And as I am in front of that patient trying to offer him a universal cuff, I realized it's again pointless because Indians, we eat with our hands. We break our bread, we dip it in our curry, and all of this is done with our hands. So Western ways of practicing OTs I found were very difficult. Similarly, for toileting, Asians have Asian toilets which require complete squatting. So a client with a complete total hip replacement would be having lots of issues doing his ADL of toileting. And you have your instructor in front of you asking you to rehabilitate them. So you have to think on your feet and come up with quick, ingenious, and creative ways to do so. The last point I would like to stress on that India, although it's a developing economy, a lot of its population is not really affluent still. So you have to come up with cost-effective equipment and splints that are affordable and accessible to these people. And to refer that point, I would like to draw your attention again to this device. This CPM machine was made of scrap aquaplast material, and all the mechanical parts and motors and all of the device in total costed less than $10. So that was something that you would look into while addressing the populations of OT in general. So as you can see, OT in India looks quite a bit different than OT in US. US has a lot of freedom in terms of addressing what electives you want to take, or the privilege of understanding what OS is. And I think students like us who have ventured out and come to the US, especially me, are trying to get this knowledge of what exactly is the rationale behind what we're doing, and take these OS concepts and apply them to our Indian culture and provide them solutions at a grassroots level. So anyone who is interested in looking into Indian OT, I would say that you would be looking at a lot of practical experience, opportunities to come up with creative ways and solutions to address Indigenous populations' problem. And if you are interested into looking more about Indian OT, watch out for that document that would have resources about AIOTA, IJOT, or other relevant sources. Again, I would like to tell you guys that this is just a 20-minute snippet of a half decade worth of experience as an Indian occupational therapy student. So if you guys want to hear more and have an encore version of this experience, please reach out to me via my email, and I'd be happy to chat with you. Having said that, I'd like to pass on this conversation to Dr. Sakshi Tickoo, who can talk more about the practice in India and what OT practice looks like there. I kindly request everyone to go ahead and unpin me so you can see Dr. Sakshi's beautiful face and a pretty presentation. Thank you, everyone.
Thank you so much, Prutha. Right. right, hello everybody. Good morning from Mumbai. I am Dr. Sakshi Tickoo. And before I get into talking about myself a lot, which I will, let me just walk you over through what I'll be talking about today. Obviously, me. Secondly, what are the prerequisites to occupational therapy practice in India? What does the registration process look like? How do we move about getting ourselves certified and licensed in India? What are the work setting and opportunities that are available to us at the moment? And the very important part, which is the culture-based occupations, which Prutha already beautifully covered and highlighted in her presentation, saying how different it is, how different the theory and application can be in an Indian setting. So let's get into it. All right. On the right, you see my very beautiful face, my dream job, that's Sex, Love and OT, which is still in making, and my very new job, that's the OT show. Just to get into the credentials a little bit, I am a new grad practitioner. I graduated with bachelor's in occupational therapy last year in February 2019. I also got my personal counselor certification. I underwent a 3 month rigorous theory and practical training to get myself certified for the same. I have been working as a school-based occupational therapist and a home healthcare occupational therapist for since 2019 till date. And now I have taken over with telehealth settings as well. Most recently, actually earlier this year, I also volunteered as a student mentor at COTAD, which is Coalition of Occupational Therapy Advocates for Diversity, in the Minority Mentorship Program, where I have two mentees under me. And I recently started working as an events lead at the Occupational Therapy Hub to bring out more video resources from all over the world. Now, going on to the second title, which I did not explore a little, is that I am also a solopreneur, which means Sex, Love and OT is a private practice that I started last year. And the OT shop is not so tiny and a kind of tiny biz that I started last month. And I'll walk you through my journey a little bit more when I get into work settings and the whole storyboard of my life. Now, working onto the prerequisites, it's actually pretty easy to get yourself certified over here. After 4.5 years of trauma and suffering and excitement and meeting awesome people like Prutha, you you can easily you can easily register yourself with the state medical regulatory boards, and then you're ready to practice. All you need to do is at least cover or at least have a bachelor's level degree in occupational therapy, and that's all. You can get yourself registered at the state regulatory boards. Now, the only, okay, I'll cover it in the next part. So this is like a slightly twisted, confusing part for everybody, not just around the world, but also for occupational therapists in India. Now, like I said, I do not have a doctorate. I have completed my bachelor's, and that's the only degree that I have. However, as I rightly mentioned, that the state regulatory boards are the one that allow us and register us and license and give us the license of practicing and everything else. Now, since AOTA, which is the All India Occupational Therapy Association, is only the national council for us, but not the national regulatory board for OT education and OT practice, which is also why you find so many disparities in how we get licensed as a professional. So at the moment, my state, which is Maharashtra, does allow me and certify me and award me the doctor prefix in my license. However, there are a lot of other states in India that do not do the same. So anytime you come across an Indian occupational therapist, do make sure they have their credentials right, and you do not get lost between what the prefix is. Now, this is the good part. So, like I've already covered the registration. I graduated, like I said, last year in February 2019, and then I started working as a school-based OT in June 2019. And there were 3 months of countless struggle torture, disappointment, and all the other negative things that you would like to add over them. So the work settings that are currently available to work in India are mostly outpatient neurorehabilitation and pediatrics. And I hated pediatrics. Don't ask me why I work as a school-based OT. So I hated pediatrics initially, mostly because of the lack of education or the knowledge that I had about that field. So while I started interviewing for more places, I did get accepted. And when I spoke about topics of how they cover mental health with neurodivergent kids, I often found that all they did was sensory integration and nothing beyond that. And I've always been passionate towards sexuality and mental health wellness and rehabilitation. So even though I got selected for, I think, 99% of my interviews, I did end up rejecting or going up to all of these places. Now, that may seem a little choosy for a new grad practitioner or just a new grad OT, but then let me tell you one interesting thing when I started to interview for my school B setting. Now, this was the only place that actually cared to ask me how would I be talking or integrating topics of sexuality and mental health with the kids. And they actually had given me like a caseload of examples. And even though I had not practiced or I hadn't started practicing as a sexuality based occupational therapist, I could still come up with answers or suggestions on the spot. And that in itself was such a motivation that when I did get the job, when I did land the job at my school-based setting, I was ecstatic and I did not think about it, even though I did not like it until then. And and that's the most amazing part about this journey that I love kids now, and they taught me something that I had missed out, that my OT school or nobody else for that matter had ever taught me while I was still exploring this field, is that sexuality occurs as occurs through the lifespan. It's still sexual development. It does not happen overnight. And when these kids started talking about emotional maturity, attraction, caring, consent, autonomy, intimate occupations like toileting, and you would think that children would be comfortable with that, and it's our need, it's a way for us to teach them, or it's completely fine to have kids naked. But then these kids are fierce, and I remember the time one of my kids felt really scared when I assisted them to the toilet, and I was still outside, but then the moment they had to lift their frock up and go to the toilet, they were so hesitant that I really had to tell them, oh, I'm sorry, I'm going to turn around, and then maybe you can continue whatever you want to do. If you need me, I'm still here. And that was the moment, and that was the moment I realized that even though we are not talking about it, these kids of age 7 years, 6 years, 8 years has already begun their phase of sexual development in life. And that is exactly how there were like so many ideas that in October 2019, I launched or sort of introduced Sex Love and OT as on Instagram, like an educational page, because I was so desperate, so frustrated that my voice wasn't being heard. And with the lack of resources, you think that social media is like a better place to connect with occupational therapists, which it is, by the way. And that is how Sex, Love, and OT came into picture, where whatever I learned in real life, by the day I was a school-based OT, by the night I was a home healthcare practitioner. So in the day I'm looking at people, I'm looking at kids who are aged from 7 years to 13 years to 18 years, and by the night I suddenly have people who are above 20 years to 65 years. I mean, that is what my ideal day looked like. And with so much diversity and so much space for experimentation, I ended up addressing sexuality with, I think, everybody in different ways, absolutely different ways, but I ended up addressing topics of mental health and sexuality with the entire population. And as and when the Sex, Love, and OT platform sort of started getting extended on Instagram, um, it was like an accidental solopreneurship that came into picture when People wanted to learn more. People wanted to know if I do take telehealth consults. People wanted to know if I'll be ready to educate them or have them or can work with them in some way or the other. And that is exactly how accidentally Sex Love and OT into came into this existence and now became like the whole solopreneur thing that I've been pursuing. Now, a little bit about how Sex Love and OT works. So, I can't leave anybody behind. And usually, when you start a business, it's said that you need to have your USP, that's your unique selling point. And people say that I'm too diverse for it, and that may be the reason why my entrepreneurship looks very different from others. But then I never did it from the idea of entrepreneurship, but to work at both a community level and also at an individual level, and to have a balance between both. I not just serve clients at the moment, I also help and advocate and educate healthcare professionals. I have one-on-one coaching sessions with them. I have conversations with students who want to develop their capstone projects and sort of go about from there. I have sessions just based on counseling where I where there's no hands-on practice, but we talk, and it's usually reserved for people who do not want to, um, who do not sort of rather have more physical problems or physical limitations, but have a much more harder time at exploring emotional and sexual problems. And lastly, that's something that I've added recently is parent and caregiver education, because um, it's only with neurodivergent children that I've seen, or parents of neurodivergent children who are interested in knowing that their child is stimming, or even with young adults, or the ones who have more sensory issues, are tactile defensive seeking, proprioceptive defensive seeking, and they usually always complain about stimming, rubbing behavior, inappropriate touching, touching somebody in their private parts, or they start pulling out or pulling those private parts, and it's only a concern, or it's only seen with them because they it usually is more embarrassing for them to witness their child do this. But but the moment you start educating them on why not everything is sexual, and why some things are only sensory based, and when to introduce self play and masturbatory play, and about private spaces, public spaces, getting perceptions. With intellectual disabilities, it does get a little challenging, but with some sensory based strategies, it works amazingly well for kids. And that is exactly why I added parent and caregiver sex education services, because these are one of the people who struggle at the moment to understand and find their place as to if their kids can be sexually active, or despite their abilities, whatever the limitations are, and that is the reason why that's there. So this is how I work as an occupational therapist with sex, love, and OT. Now, the OT, the solopreneur thing, the OT shop launched last month, and that was one of the ways of putting together my passion of creating and designing something and still be there for occupational therapists at the same time. You can definitely check it out, it's awesome. And lastly is collaborate and hustle. I mean, a year in reflection, if you would have asked me in June that I would be doing so many things, or I would be here presenting something about occupational therapy practice in India at USC, I would have laughed at your face. However, after a year from Sex Love and OT, I cannot remember the number of collaborations that I have, or even the roles that I play at the moment, be it through an occupational therapist at my school, or be it through my private practice, or just volunteering as a mentor. I mean, there are so many things that have happened since October 2019 that I cannot begin to explore. Like, I've lost track of it. But and that is exactly how it has been when I started all of these things. Now, even though it looks all good and awesome, and that I was able to do it, the biggest drawback of practicing occupational therapy or practicing this niche in occupational therapy in India is that one, I am young and I am a woman, and somehow and that equals to being a pervert. So, and this is not just the case in India. It's everywhere around the world, because every time I have conversations uh, on sex love and OT, I end up having people from all around the world. I have seen so many genitals, unsolicited genitals, and that is the whole perception of it, so even before I had to start, I had to let people know that this is not about a sexual service, but it was something about sexual well-being. And and that is how the addressal has always been. But the six main barriers that I think that I have witnessed was: one, gaps in theory and application, which Prutha rightly mentioned. Occupational therapy is a very westernized concept because it does talk about occupations, but it also lacks to address the fact that the context of these occupations, as in how and when are these occupations conducted, and how are they going to vary according to cultures. And that's the absolute reason why I started learning more about occupational sciences, thanks to Prutha, because she educated me on this concept and encouraged me to learn more about it. And at the moment, there's it explains, or sort of going about occupational therapy in India with with the view of occupational sciences makes much more sense to me than just pursuing occupational therapy blindly. Secondly, the heavy caseloads. We would see about 30 patients, 50 patients in a day. So at the moment, you only have one therapist for 15 patients. So to even have that effective delivery model or an effective occupational therapy treatment for your clients is nearly impossible. Third, we aren't taught OT because there's so much, the OT is left open to interpretation. So since we do not have one common regulatory board, our education curriculums are different all over the country. So in whichever state, so there's occupational therapies offered in more than 20 plus colleges. So you can easily assume that 20 plus colleges are going to have at least 10 different OT curriculums, OT education curriculums, and there's no standardization. And if there's no standardization, there's obviously going to be disparities in what you are being taught or what you apply when you go back to practice. Fourth is resistance to change. Nobody likes it. Nobody likes it, and nobody talks about it. And entrepreneurship is something that's not being done here, especially with sexuality and intimacy. I don't even think people think that it exists. It's just a part which can be easily avoided, because if you talk about it, you are a pervert, or it should not be talked about because clients might be more hesitant to share it, which is absolutely not the case. It's always the clinician. Always after 1 year of practice, it's never the clients that it's barely the clients that are hesitant, because they are really happy to address it. They are really happy, and it's mostly the client's unconscious bias that has been stopping them and being more resistant to how they want to pursue this field. Fifth is it's not being insured. So rehabilitation services at the moment are not covered by insurance services, which is another one of the biggest factors why clients do not approach occupational therapists or any other rehabilitation specialist when there are any concerns in the medical field. And lastly is malpractices. Um, I don't want to go into that, but when things are not standardized and left open to interpretation, there are often chances that these malpractices occur because you do not have a one regulatory board to look over it. So when I say that occupational therapy concept is too westernized for us, that also leaves us space to add some spaces of add our elements, or use some parts of our anecdotal experiences, which may not be evidence based and do not support the rationale in any way, and lead to malpractices and still not work in the relevant routine. So I may have disappointed you by saying that, but then there are certain things that happened while staying here. One of the greatest examples is I since I started practicing sexuality and intimacy based occupations, I started asking clients this question about what their pronouns were. So even with telehealth services, most of my clients were usually very confused. They used to be like, "What?" And then I had to explain them that pronouns are she, her, they, and I continued it. I didn't stop using that. And once what happened was there was a client, and I asked them, "So what are your pronouns?" And they were like, "What?" And I asked them, pronounce this. I did the same thing that I do with all of my clients. And they're like, it's they, them. Thank you very much for asking. And that was validating in a way because nobody teaches you that. And there are like a billion things I wished people taught me. But then the lessons that stayed with me are the ones that I've experienced on my own, integrated on my own, and used on my own, and validated not just the the pain, the pressure, and everything else, but also the presence of my clients. And that is exactly why, and the only reason why I give this example is because not OT school may not teach you everything, but then life is awesome and you are your best therapy material. There's going to be trauma, there's going to be suffering, there's going to be excitement, there are going to be barriers to your practice. There are going to be spaces where you do not have your job, like you may not have your dream job, but then you always have the option of creating that change, bringing your passion into action, and be your best therapy material that's possibly out there. So trust your gut. You know it. You know your experiences. You know your values. Stay true to them, and go ahead. And also stay cool. Thank you so much.
Thank you, Dr. Sakshi and Prutha. Those were both great talks, and I feel like everybody kind of is giving a silent round of applause. And so I would like to open up the chat for questions if anyone would like to submit them, but I'll start with the ones that were submitted through our Google form. And so, just starting with Prutha, how has your experience as an OT prepared you for your current residency?
I would say more than my experience, I always wanted to work with kids in the NICU ever since I was a kid. No, I'm just kidding. But no, I have had this passion of working in a pediatric setup, and then as and when I went into my field work during my internship and my fourth year, I got a lot of exposure to the NICU, and that kind of opened my eyes on what could be done in the NICU setup and what was my take on what is happening in India and how things can be changed. All of that was a big driving force towards getting more and more knowledge on OT based NICU that pushed me to go to the US, come here, get educated here. So I would say a lot of it was self motivation that got me here in the US. And apart from that, when I came to the US, I would say talking to our faculty mentor at the time, academic advisor, Dr. Ot, helped me a lot with exploring my options as to what I could do in a NICU based setup or how I could go in that direction. So I would say it was one self motivation to get into OT and NICU per se, B the drive to get outside of India to um, equip myself with skills that are going to help the population in India. And third, I would say the support I got from the faculty at USC and just the opportunity to explore OT in the NICU setup was what got me here. Yeah.
Thank you so much for your insight, Prutha. Kind of shows us how, like, your journey to get to where you are today, right? Thank you. So next for Dr. Sakshi, how do you go about increasing your knowledge in the area? Do you think having a sex therapist license would be beneficial when addressing this topic? What is something you wish you knew when you first started addressing sexuality?
So you first of all, you do not require a license if you really think that you need one or that would make you do better. You can obviously have it, but as far as sexuality and intimacy is concerned, the occupational therapy title is more than enough for you to address and practice in the field of sexuality and intimacy. That's more than enough. As far as the education goes, there will not be a lot of research supporting a lot of things. We do not have an evidence-based approach at this moment. However, you can still have an evidence-informed approach. So what I usually do is I use the same treatment modalities or protocols that have been suggested for other things or for other areas of practice. Say with sensory integration, I end up using a lot of sensory integration techniques with my adult clients as well, and it works like a charm. So and I think that's exactly what I wish I knew, that frameworks and models are highly customizable and expansive, and you can use them in whichever way, whichever setting you want. That's the greatest thing about frameworks. You just need to change your perspective, and the framework is right there. So.
Awesome. Thank you, Dr. Sakshi. And we'll go ahead with one more question before we close out for the night, as I believe we're nearing the end of our event time. And so, to both speakers, what advice do you have for students who want to gain experience abroad in underdeveloping countries that may not have established OT program boards in place? What are ways we can spread knowledge about OT internationally in general?
I can speak to that first. I would say advocacy, advocacy, advocacy. The greatest thing about our profession is our need to go around and educate and talk to not just OTs, but people outside of OTs and explain what we are doing. And having events like these are obviously, they help with the cultural exchange and gives you insight about what things are like in countries outside of US and India. And there's more to learn, always more to explore. So I think just having conversations and then looking at legitimate resources that are official for that country are going to give you the most reliable resource and help you with getting a bit of perspective.
I agree. I mean, I'm all for advocacy, but also understand what, also try to get a perspective of occupational sciences as well. I mean, even with occupational therapy, I think we are still forgetting the whole idea as to why occupational therapy was started, and we often forget the word occupational sciences over there. And honestly, when Prutha introduced that to me, my life was completely changed. I could I can practice on my own. I can devise my own treatment plans, and occupational sciences is very empowering in ways that I cannot understand how, but then it is. And when we start advocating for occupational therapy, we also need to start advocating for occupational sciences, and sort of have more awareness towards the whole culture-based occupations and the idea that that is how occupational therapy is. You can bring it to your country, you can put your culture, you put all of your senses into it, and then adapt yourself to whatever the needs that there are. So yeah, that's from my side.
Thank you so much to both our great speakers tonight. They've had really great presentations, and we really appreciate them carving out a little bit of their time to present to all of us today. I believe we're at the end of our time, and so we'll be closing out. But before we close out, Prutha and Dr. Sakshi, would you mind putting your emails in the chat box just so that everyone has access to you both, just in case they have any other questions or concerns or advice they would like to seek from both of you? But was there any closing remarks you'd like to give our students or attendees before we kind of end for tonight?
I'd just like to thank everyone who took the time out of their lives during quarantine. Instead of watching Netflix, they listened to us. So that was really nice and encouraging. I really want to thank Danny and Nikki for, again, having this opportunities. I look forward to doing more collabs and inviting more of my friends here. And yeah, just introducing what India is, not just an OT, but there's more to it. Outside of OT world, there is more to India that can be looked at from an OT lens, and it can be very interesting. So thank you all for showing interest, and I look forward to having a chat with you guys. So take care.
Oh my God. So thank you, Prutha, thank you, Nikki, thank you, Danny, for first of all having me over here, inviting me here. My experiences are still fairly very new. I don't call myself a really great professional, but then I'm awesome with whatever I have done so far, and that is exactly what I need to share with you all, that you are awesome wherever you are. Do not try to compare your journeys. I mean, I had totally different plans for myself. I was supposed to be in a different place doing different things. But then that wouldn't have happened, and I wouldn't have met you all. I wouldn't have had the opportunity to collaborate and have such a large community, which I can share my experiences with, inspire them, and the questions that you all had. Oh my God! I mean, that's incredible, and that just makes me realize that if I wouldn't have done the work, and I might have missed it, and so many I would have missed on inspiring so many people. So I'd take that any day for not being where I imagined that I am. So go with your gut and take that wisdom nugget with you. Say it at least 10 times to yourself in a day when you start doubting yourself, because you guys, all of you folks, are incredibly awesome. And that's all. Just stay cool, stay awesome. Life is going to teach you how to go through OT. Thank you, everybody.
Thank you so much to everybody. And Danny, did you have anything you wanted to add before we end for tonight?
Not really. I wanted to actually really congratulate Nikki for putting this together. I had very little to do with any of this, so congratulations to Nikki. Dr. Sakshi, thank you. I know that you joined us at about 7 o'clock in the morning, your time, so I really appreciate that. Prutha, I don't know, I think I might embarrass you by telling you I'm so proud of you. We've known each other for a while, so congratulations to you, and
Thank you very much,
that's
Danny.
great.
Always nice to be.
And I want to thank everybody also for joining as well. We've recorded the video, and so actually, if you would like access to the video, please email me. And I also know that there were many other questions that you guys that you all submitted when you filled out the application, when you filled out your RSVP. So we'll go ahead and we will ask both Prutha and Sakshi to answer those as well, because there's some really rich questions, and there's never enough time. There's never enough time. That's why we have to keep doing these things, right? So, yeah, Dr. Sakshi, it was such a pleasure to meet you, and it's great now we have this partnership, and we can see what else we can do together. And I just think that what you talked about today, even in just a few minutes, is just unlike anything that I think most of us have really thought about in OT at all. And I think that you're doing that in your particular context is just really just amazing. I want to find out more about. I mean, I can just imagine that it was not easy, and it's not continuing to be easy. And so, we can also be allies to you as well. So.
Thank you so much. That really means a lot. To have a receptive community is always the best thing that I hope for.
Yes. Okay, so I think that's it then. So Nikki, great job. Thank you, everybody. So I will. I guess I will feel free to leave. Feel free to leave. I won't quite end the meeting right yet, but feel free to kind of drop out. Have a great night. And I'll go ahead and stop the recording.